Greetings, everyone. It's Gabriel over at Home Instead, and I'm excited today that I'm being joined by Sarah Walsh. Sarah Walsh is the clinical director over at Total Life, and we just thought it was a great opportunity to talk about mental health and some of the senior issues that are really plaguing older adults. Um, Sarah, tell us a little bit about yourself. Tell me what makes you happy.
Okay, sure. I'm a Jupiter, Florida resident. I love to cook. I love to be outdoors. So that's kind of about me personally. Um, I have been a Jupiter resident now for almost 20 years, living in South Florida. And for much of that time, I have been working with older adults here in South Florida. I was at Jewish Family Service for many years, primarily treating older adults and seniors. And I really have a passion for this population because there's such a need for services.
There really is. And I think, Sarah, a lot of people don't realize that these mental health services are covered by insurance. And I kind of want to open with that because people don't realize that the help is there and it's not out of pocket. So how does that work?
Exactly. Well, all therapy, individual therapy and group therapy is covered by Medicare. So this is something that I think a lot of seniors and really a lot of people who are helping seniors don't realize that your clients who are depressed, who are anxious, who are lonely can receive weekly therapy sessions or more if there's a need, a medical necessity for that, group therapy where they can enter a group that is specific to what their needs are: anxiety, depression, bereavement, loneliness, and connect with other seniors around these issues, which has a really great impact, positive impact on their mental health and on their life. We want to improve quality of life for seniors. That's really our mission.
Yeah. Especially now, Sarah, I mean, I would think we're going through a senior mental health crisis with all
We
that's
are.
been. It just seems that for the past year and a half, our phone is ringing off the hook, and we're seeing more and more anxiety, more and more depression, and it certainly has had to do with the pandemic. But even prior to the pandemic, the isolation is real.
Oh, absolutely. One of the things that really, I've been with Total Life now for 9 months, and Total Life was really born out of the pandemic. We knew that we had a mental health crisis with seniors before, but COVID really escalated that to such a level. And when I came to be employed by Total Life, I was so excited because I thought, this is really what is needed. We have 55 million seniors. We have, by the year 20, I think 30, or no, 2050, we're going to have over 75 million seniors. Okay. 43% of seniors report now feeling lonely and depressed, but
Hmm.
sadly, only 10% actually get the mental health treatment they need.
Do you think it's because of the stigma of getting therapy?
I think that's certainly a part of it. I think that especially the older generation have been taught to, pick yourself up by your bootstraps. You can do this on your own, and they're not. They really haven't been exposed to mental health and mental health treatment. Luckily, the Gen Xers and millennials are really embracing this, and they're much more apt to seek mental health treatment. But we really need to catch our seniors up in terms of it's okay to need help. It's okay that you need to process your feelings. You need to talk about things that are happening within your head. Just as important as, for example, taking medication for high blood pressure. And actually, we know that it improves quality of life and actually extends their life when they are taking care of their mental health.
So how do we, I don't even have to go too far. How do I, as a son to a 90-year-old, breach that and have that conversation with my mom without her turning around and saying, "What do you think? I'm crazy? What do you think? Something's wrong with me?" So how do I? What tools can you give me that so I can at least start that conversation?
Well, I think it's really important to validate someone's feelings. So maybe begin to listen more than talk to. So, I mean, my parents are in their mid 80s as well. And when I speak to them, I have to put on my therapy hat. And that's what I want you guys to do and say, how are you feeling? This must be really hard for you.
Right.
Close your mouth. Hear what they have to say and validate that. My own father, is in his, mid to late 80s. He was a very accomplished athlete. He
Good for him.
was the man. Okay.
Yeah.
And now, sadly, he has medical issues, some neuropathy that make him very unstable on his feet. He has to use a cane and a walker. The effects of that has been, really devastating for him emotionally. So in approaching someone like that, I would say, this must be really hard, and let them talk to you. And then really simply say, I have information here about a way that you can receive some support around that. I want you to be happy. I want you to enjoy what you have left and make the most of your life. Maybe it would be helpful to join a group, and it's very easily to access. It's all online. Okay. And what we found is that most seniors, especially because of the pandemic, they are tech savvy or getting more so. Okay. Or they have family members or caregivers who can assist them. Okay. So on an iPad.
Right.
Here, let me just click this link for you. There you go. Meet Sarah Walsh. Hi, how are you? And so they see how easy it really can be. So not only is it affordable to see a therapist or join a group because it's covered by Medicare, but it's also it's accessible. I mean, actually, I have a funny story because I was treating, I've been treating some of my seniors for a very long time, 5 years, 6 years. And then here is COVID hits and we go to telehealth. 95% of my seniors transitioned incredibly smoothly to this. And as a matter of fact, many of them have said, do we ever have to go back to seeing each other in the office? Because I don't want to. I love this. So there you have it.
That's great. Okay, so we want to ask, we want to listen, we want to
Yes.
validate,
Yes.
and then we want to introduce some solutions.
Yes. And I think that, it may take several conversations. Then let's say they're resistant, you can bring it up again in a few weeks or a month and say, Mom or Dad, I've seen that you are isolating more, you're having trouble sleeping, you're not participating in the activities that you used to, and we're concerned. Have you given any more thought to talking to someone? Can I make the call to Total Life for you?
Right.
Would you like to talk to someone from Total Life first? Just a consultation. We realize that seniors need TLC. We'll talk to your loved one and say, hi, I'm Sarah from Total Life. Let's talk about what we can do for you. Tell me about yourself. Make that connection. And then maybe that will encourage them to actually, sign up for services with us.
What are some of the common stresses that you guys at Total Life are seeing?
I think that loneliness is a humongous factor, especially for those who don't live around family. At that, and of course, COVID again. Financial stress. Many seniors have financial stress and strain and worry. Physical decline. I mean, all of us, we cannot escape Father Time. So all of us, as we age, experience a physical decline. And it's very, very difficult. Go ahead.
How do you manage that feeling? No one wants to get old.
I know.
Where do you even go with that? You were just talking about your dad. Your dad was invincible. He's been kicking butt his whole life, and now all of a sudden he has to use a walker, and he has neuropathy. I mean, that is very stressful, and that it just makes you feel mortal.
Yes. Well, what we do is cognitive behavioral therapy is a type of therapy that has been proven to actually work. And all of our therapists are very skilled in this. And the premise of that is that what we're thinking impacts what we feel. Okay. And then it impacts how we behave. If we think about situations in our life and problems in our life in a very negative way, we are going to feel negative and depressed, and we are going to act accordingly. But if we look at a same situation in our life, okay, so let's take my dad, for example. He can think about his issues as, this is so horrible. What has happened to my life? My life is over. What is the point? What does my future have for me? And very negative, and that puts him in a very dark, very depressed, lonely, isolating feeling. And then how does he behave? He is depressed and he does nothing. Okay. But what I have actually tried to help him with, and what we help all of our clients with, is we need to change your thoughts. And when you find yourself going down that rabbit hole of those negative thoughts and spiraling down, I want you to say to yourself, stop, wait a minute. Okay. This is not helping me. I have life left to live. I want to make the most of it. Yes, I have limitations. I have neuropathy. I have decreased mobility. But what can I do? I can go to the gym and sit on an exercise bike. Okay. I can have physical therapy that is going to help me with my balance. I can enjoy my grandchildren and my lovely daughter on a regular basis and see them grow up and go to college and be successful. So we need to change the way we think. And so what does that do to how we feel? Okay, it's not going to make everything awesome, but we're going to be able to have better feelings about our life and then behave accordingly. So we really try to teach our seniors to change the way you're thinking about things. We were talking earlier about people who are given a terminal diagnosis.
Mm-hmm.
Some people totally rise to the occasion. They fight, they have a positive attitude, and they live years longer than expected. But the other people, right?
I see it all the time. And like I mentioned to you earlier, it doesn't even have to be a terminal diagnosis. It could be a diagnosis, and that individual takes it the opposite way, and it becomes terminal. It's the power of our thinking, and we truly become what we think about the most.
Absolutely.
You know?
Absolutely. So depression and anxiety is also a really big factor among seniors. And, loss and bereavement, losing a partner, a spouse. Many times we're living longer, losing a child, sometimes losing a grandchild tragically. So these are all things, losing friends, the older that we live,
Life
the more.
events. I did one of these not too long ago with Dr. Dale Young, and the reason I bring him up is because he's very good at reconnecting adults with their spirituality. They have been working for so long, and they have had a place in this world where they feel that they are contributing. And then all of a sudden they're 65 years old, or they're maybe they got to work a little longer, but they have this huge disconnect within themselves because they are no longer working, and they feel almost like as if they're not contributing enough. Do you see
Oh,
some of that?
absolutely. I think that there's a lot of, misconceptions. We think, oh, we're going to retire and everything's going to be great. But for many people, their life has been their work. There's been purpose there. It's improved their self-esteem. They got a lot of gratification from their work, from their job. And now that they don't have that, they do feel like they don't have a purpose, and they do feel very isolated, and they're not getting the positive reinforcement in terms of their self-esteem. So what we do is we really try to help seniors in terms of, let's identify what you can do. Where can
Right.
what else can you do? Can you volunteer? Maybe you want to start a little business. I mean, maybe an early retirement folks, what can you do in order to bring purpose and fulfillment to your life now?
A lot of times I come into the home and I'll say, okay, well, what did you used to do that maybe you no longer can do or feel that you can't do? And it'll be something like, well, I used to be able to go to the museum whenever I wanted to, but I no longer drive. And then with the assistance of a caregiver, they're able to make that pivot, and it's not something that you can undo. You just need a little bit. You need somebody to drive you because you're not driving anymore. Um,
Yes.
Sarah, the power of our thinking is so, we take it for granted, and depression and anxiety can absolutely lead to more serious ills, real sticky stuff, heart issues.
Yep.
What are we doing to be able to just try to curb that a little bit? And I know that we kind of keep hitting on that, but I just don't think we could say it enough of,
Right.
making sure that folks know that the access is there. And if you don't do something about it, it leads to a lot worse things.
Right, right. I mean, being depressed and anxious as a senior, that increases your mortality by 43%. That's a statistic. That's
That's
significant. That's almost 50%. So if you think about the fact that if a senior who is depressed and anxious receives help and feels better, what does that mean? That their chances of living are 50% greater if you change that around. So I mean, I just really, you're right. We really can't emphasize enough that as important as it is for seniors to take care of themselves physically, it is equally as important to take care of yourself mentally.
And I think that us as children, because we'll always be children in our folks' eyes, need to do a better job of providing those resources. We need to do a better job of asking the right questions. We need to do a better job at listening.
Yes.
And then, like you mentioned earlier, validating these feelings. These feelings are real.
Yes.
And I think if we can start in our own homes, we really then start to create awareness.
I mean, you bring up an interesting point that it really is up to the family and the friends of these seniors to be able to give them resources. I think that the children of seniors need to examine their own feelings about mental health. What are their own, biases? So we really need as a country, okay, to and we're making progress to attack that stigma of mental health and say, you know what? Yeah. So if you believe as a 50-year-old that mental health is important, you're going to encourage your folks to feel like it's important and get help if they need it.
This has been wonderful. How do we find you? How do we find Total Life?
Sure. So you can find us at www.totallife.com. And you can call us, Gabriel. I just don't have the 800 number right in front of me, but the best way is to contact us online. Go to our website. You can reach me, Sarah, SARA, at totallife.com, or call me 561-779-7925. Happy to help anyone navigate and access our services.
Excellent. Thank you so much, Sarah. Any parting words, any little wisdom that you want to give us before we say goodbye? Not trying to put you on the spot, but I just think that you have a plethora of knowledge, and hopefully we can get this up on YouTube soon and be able to share it and if we get to help one person, then we did our job.
Absolutely. We want to just reach as many people as possible. And I want to thank you and Home Instead for really getting it and understanding the importance of this. And I appreciate you having me here today. It's been a pleasure.
Thank you, Sarah. I appreciate you.
Okay.
Have a wonderful day.
You too. Bye.
Thank you. Bye-bye.